How to use a tuning fork. Rinne and Weber tests. Tuning forks can be used to determine the type and laterality of hearing loss. Conductive versus sensorineural hearing loss. Conductive hearing loss results from a problem in conducting sound from the pinna to the inner ear. Sensorineural hearing loss is a problem sending neural signals from the cochlea to cranial nerve 8 and onto the brain. How to differentiate the two types of hearing loss? The room should be reasonably quiet. Tuning forks should be hit on something a little soft to ring truest, not a hard table. Hold them by the stem with 2 fingers. Use the 512 Hz fork. For the Rinne test, place the tuning fork on the patient's mastoid to measure bone conduction and then adjacent to the patient's ear to measure air conduction. The instructions you give to the patient are, "Tell me when you can no longer hear this." Then place the fork on the mastoid. When the patient cannot hear it anymore, move the fork adjacent to the pinna. Usually, the ear will hear the sound again. If you wait long enough, the patient will indicate that the sound has again disappeared. In normal hearing or sensorineural hearing loss, air conduction is greater than bone conduction. In a conductive hearing loss, bone conduction is greater than air conduction. Remember, a normal test is a positive Rinne test and an abnormal test is a negative Rinne test. For the Weber test, place the tuning fork in the midline of the patient's forehead pressed firmly into their skin. In normal hearing or in a symmetrical bilateral loss, the sound is heard in the midline. In a conductive hearing loss, the sound is louder in the affected ear. It lateralizes to the ear with a conductive hearing loss. If there is a sensorineural hearing loss, the sound is louder in the better hearing ear. You can boost the patient's perception of the sound of the fork by placing the vibrating fork between their teeth. Clean the fork before and after this maneuver. If you can't remember the Weber rules, get your tuning fork, set it in motion, and place it on your forehead. Plug one of your ears with your finger and you'll quickly find that the sound is much louder in that ear. Weber lateralizes toward a conductive loss and away from a sensorineural loss. You can put these two tests together to describe a patient's hearing loss. Here's a case for you. The patient complains of a left hearing loss. Weber lateralizes to the left ear. Rinne for the left ear shows that bone conduction is better than air conduction, a negative Rinne. Rinne for the right ear shows that air conduction is better than bone conduction, a positive, or normal, Rinne. What kind of hearing loss do they have in the left ear? If you said they have a left conductive loss, you would be correct. This could be from impacted cerumen, a middle ear effusion, or otosclerosis, for example. Try another one. This patient also complains of a left hearing loss. The Weber lateralizes to the right ear. Rinne shows that air conduction is better than bone conduction in both ears. What kind of hearing loss is most likely in their left ear? If you said a left sensorineural hearing loss, you would be correct. Practice with your tuning fork. Thank you for watching. Here are some resources for further study.